Okay, as our next speaker makes her way up to the stage, I want to just see a show of hands. How many people have had an issue once or twice with their insurance company? All right, so the next speaker is very important to our conference. Michelle Graham is with National Rehab, and she's going to be talking to us about navigating the insurance maze. That's one word for it.
Hello, everyone. Again, my name is Michelle Graham. I work for National Rehab Equipment. Many of you already met me or know me from speaking with me on the phone concerning insurance issues that you have. I actually handle insurance contracts at National Rehab. I also advocate for EB patients across the nation. Everyone who has dealt with insurance issues knows how difficult that can be. So what I've come up with is just something simple, put together some information that I can go over quickly. I actually have another presentation. It would take actually 3 hours to go over, so I kind of condensed this and made it into like a 15-minute program. So if you do have any questions that I don't answer in this presentation, please feel free to come see me afterwards. So. We're going to go over managed care first. Most insurance we deal with right now, when you're employed, these are the plans you're going to be exposed to. This is, again, basic information. An HMO is a health maintenance organization. They require a PCP to direct all your care, meaning that you need a PCP to take care of your needs. If you do not have a PCP, they're going to assign one to you. If you do not utilize your PCP, your plan won't pay for anything. HMOs do limit your choices. There's no out-of-network benefits, and normally the coverage is regional, meaning that it does not travel out of the state. If you need to go out of state and see a doctor, you're going to need a referral or some kind of authorization for that care. PPOs, which are my favorite of the managed care plans, you can see any doctor, facility, or other medical care within your network at the highest level of benefits. Basically what they do is they give you a book about this thick and say, here's all your in-network providers. And if you utilize those in-network providers, you'll have the highest level of benefits within your benefits. But you can go out of network, and you can see an out-of-network provider, but you will have lower level benefits. You're going to pay a higher deductible and higher out-of-pocket. You normally do not need a referral and authorization for these plans. It is the most flexible of the managed care plans. The Blues Network, for example, has probably one of the most extensive network with the PPO. It's called the Blue Card Network. You can pretty much see any doctor or hospital that's participating with your local Blues. It's, again, probably one of my favorites when it comes to the managed care plans. Point of service. This is really common with the Cigna plans. It's also common with United Healthcare plans. It's kind of an in-between. You have the highest level of benefits if you use it like an HMO. They'll assign you a PCP, and if you use the PCP to have them direct all your care, you'll have the highest level benefits. If you choose to self-refer yourself and go to any doctor or hospital you want to go to, you'll still have coverage, but you'll have a higher deductible and out-of-pocket. So it's not a bad policy to have, but normally your out-of-network benefits can be a little higher than a PPO out-of-network benefit. EPOs are not as common, but you will see them with the Blues plan, and you will see them with like United Healthcare. They're very popular with United Healthcare. Remember that book I was just talking about with the PPO? It's basically they give you the same book, it's the same network, but you have no out-of-network benefits. So you can go anywhere within the network. It works really good with the Blues network because it's really hard to find a doctor that doesn't participate with the Blues. Now I'm going to go over some government assistance because this seems to be the question I get a lot. Almost every question I seem to get, at least on a weekly basis, is something about getting some additional assistance. For Social Security, Like I said, this is a very popular question. From birth to 18, a child can be eligible for Social Security benefits for a disabled child. Once you're eligible, you then can be eligible for what they call Medicaid waiver program. The health benefits may be available in your state for those programs. They vary. So what's covered in one state is not covered in another. So when you apply for Social Security for your child, that's a federal benefit, but your medical benefits will be on a state level. The application can be filled out online or it can be mailed. It's like a 14-page application, but you still need to call the Social Security office to complete that application. But here's the interesting part, which I think I've had this question. People said to me over and over again, I won't qualify, my child won't qualify for Medicaid. Under the TAFRA Act of 1982, you should only need to enter your child's income when filing that for a disabled child, meaning that when you're filling out that paperwork, you don't put down your income, you put down your child's income, which, so depending on how old your child is, if they're not working, then you're going to put 0. The number that's really important is call the Social Security office. They will answer any questions for you. They're open from 7 a.m. to 7 p.m. Monday through Friday, and they'll walk you through that process. Once your child is an adult, Medicare benefits should become available, but please know it takes 24 months for Medicare to become active after applying for SSI. So if you apply for Social Security benefits, 24 months after your date of being eligible, then Medicare would kick in for an adult. Also know that each situation is different if your child will qualify for SSI or Medicare. It really depends on documentation. I know many people have come to me and said, I don't understand why I didn't qualify because this person I know here is so much not as bad as my child. It's documentation, it's paperwork, and sometimes you might need assistance on getting that paperwork filled out. Medicaid. Medicaid coverage is for people with low income, little resources, or in some states, medical need. 18 and under normally has good coverage because of the TAFRA Katie Beckett waiver program. I'm sure many of you have heard of the Katie Beckett program or have a Katie Beckett program set up within your state, and I'll go over that briefly in the next slide. But once you turn between the age of 18 to 21, depending on the state that you're in, coverage benefits start to reduce. The Katie Beckett waiver program, it was actually developed to allow parents to access Medicaid for their child with disabilities or have medical need without having to financially qualify for Medicaid. The coverage, again, varies state to state. You do not need to apply for SSI to qualify for a Medicaid waiver program as well. The best thing I can tell you when you call to apply for a assistance for your child, if you need additional assistance, is ask them what type of Katie Beckett program they have. The federal government does not require the states to cover things very specifically under Katie Beckett. So what's covered in one state is different than what might be covered in another, but medical, as far as financial qualifications, that really should not be an issue. And what's nice about these waiver programs is they will pick up what Medicaid normally doesn't pay for. So if you know that your state Medicaid program does not pay for much under supplies, that's usually not the rule with a waiver program. When a child's under the age of 19, they will pick up just about anything. Tips and different ideas. If any of you have ever talked to me before, I'll always ask this question. Knowing the difference between a self-funded insurance and a fully vested insurance. Know that if you have a self-funded plan, your claims are paid by your employer group. They are not paid by the insurance company. Your employer group puts funds in the money in a fund, and they pay each one of your claims out. Fully vested is when your employer pays an insurance company to manage your health care, and the insurance company actually pays the claims. That's really important when you're trying to appeal to an insurance company. You know then who to go to. If it is self-funded, you're going to go right to your employer group, and that's who you're going to ask them to help you get coverage for your child. Another one is work with your employer's human resource department prior to changing plans to ensure that the changes will not affect your child. I cannot stress that enough. I can tell you every January I get phone calls when people are like, my insurance plan changed and now I don't have wound care coverage for my child. If you know 3 months in advance there's an insurance change, give me a call. there's processes you can go through to make sure and verify that your child's not going to lose those benefits. Another one is being proactive. And anyone that's ever has ever used me to do an appeal for them knows why I'm asking these questions or asking you to do these things. Keep a current picture of your child. And I'm not talking like the one at Christmas, or I'm talking about the clinical pictures. And I know that seems maybe harsh, but these are the ones that the insurance company needs to see. They need to see why they need these bandages. And for you to get things approved and taken care of by the insurance company, they need to see that your child has a face. And this is their life, and this is what they deal with. Record all medical staff your child has seen. It's really important also in the appeals process. Documentation of your child's medical history if possible. It's just you being proactive, because if you switch doctors or you move, you want to keep those records as close to you as possible. And another really important key factor is keep a record of every person you've spoke with at the insurance company, and date who you talked to, because they will tell you later on, you didn't speak to one, or you didn't know, I don't remember that phone conversation. They normally record all their phone conversations, and ask them that when you're on the phone. Ask them, is this phone conversation being recorded? Another big one is ask for case management at the insurance company level. What a case manager is supposed to do is they're supposed to advocate between the insurance company and the patient. They're supposed to be cost effective for the insurance company, but ultimately they are the ones that are going to realize that it is much cheaper for them to pay for wound care supplies than a hospitalization because of an infection. So if you have trouble with getting supplies, case management is the first thing I normally recommend someone do is try to get that initiated at an insurance company. If you're having issues getting supplies or other medical care within your network, you can go out of network and ask for an out-of-network provider to be considered. This has happened on many occasions where people have trouble getting supplies or having trouble seeing a specific doctor. They'll say, I want to go here, but they're not in my network. If you ask for them to do a predetermination on that and say, there's no providers in my area, this doctor does not handle my child's specific needs. If you have someone in mind, they will make a consideration for that. And I've only had probably, in all the cases I've done with this, I very seldom, I want to say, 2 out of 10 do I have a problem with. Denied coverage. I'm sure many of you had either been told up front that coverage is denied, or you've had a claim that is processed through and coverage has been denied. Do an appeal or do a predetermination. Appeal will be done after the insurance company processes the claim. So if you get a denial, an EOB, or an explanation of benefits from the insurance company, they'll tell you that you're responsible for the dollar amount left. You can do an appeal. But it's much easier, and I recommend this prior to getting that far, is doing a predetermination prior to the claim being submitted in. Meaning that before you receive supplies, or before you see a doctor, before you go to a hospital, if you're not certain it's covered, ask for a predetermination. And that normally takes 30 to 45 days, but it's much better to deal with that than a very high medical bill. Definitely get your doctors involved with the appeals process. Most doctors are very proactive, especially what I find with a lot of the doctors that deal with EB. They are very proactive with helping getting things covered under the insurance. Again, pictures, videos, you want to give a face to your child. If you don't give a face to your child, they just look at it as another number, and you don't want that. You want them to realize that your child is a person. So this is probably one of my most important things. It's one of the biggest things I ask for doing an appeal. Another thing, I'm sure many of you heard of a DME Max or Durable Medical Equipment Max. Don't assume that's set in stone. I have gotten around 90% of the DME Maxes that are set by insurances. I've gotten around Aetna, I've gotten around Blue Cross Blue Shield, United Healthcare. There's ways around that DME Max. You just have to appeal. And if you need help with that, I can help you with that. Again, if you have problems, that's why I have it on here. Call me. Don't hesitate to call me. My number's on there, 1-800-451-6000. 6510, extension 5319. If you want to email me, feel free to email me at mgraham@nationalrehab.com. I have worked several appeals, and I find that the insurance companies do your own appeal. Sometimes your doctor's information isn't enough. I attach another letter on top of that that gives a little more detail about your history and things that you tell me. And if you give me information about your child's background, about I had one mom tell me that she couldn't get supplies because the orders were they were on back order, and she couldn't bathe her child for 3 weeks. So she wanted to switch suppliers. I put that in a letter to the insurance company. It made all the difference. So again, if you have any questions or concerns about your insurance or want to change plans, before you change plans, call me. And I can help you with that to make sure that the coverage is there. And that's it. Does anyone have any questions for me?
I have junctional EB as well as, sorry, my mind went blank. I have junctional EB as well as an immune disorder.
Okay.
I take gamma globulin. I got kicked off my insurance at the beginning of this year. Actually, our my husband's company changed insurance companies at the beginning of the year, and we got kicked off after I'd had my $10,000 per month gamma globulin treatment. My case manager, I had to go through an appeal process that took several months, and my case manager through the insurance company, you said they work for the insurance company, right?
They do work for the insurance company.
Okay. She turned around on my second or third appeal. I asked them to call me to let me know, because it takes 14 days or more to get the letter in the mail. And I asked them to call me so I could get it arranged if this appeal was going to go through. And she turned around and used all those things that I had said my objections to in a letter to me personally, or in a letter to me as though they had addressed those issues from the beginning as to why they turned me down.
No, this is insurance. This is insurance through your employer group, correct?
Right.
And they
weren't telling the employer HR person the truth either, because they acted like, oh, well, I just kind of hate my insurance companies right now.
I actually would love to see in detail everything that's going on. I might be able to help you with that. I've had situations before where insurance has been dropped, and I've had those reversed. It's a paperwork process, and sometimes when you get someone that's a case manager, they're, I want to say lazy, but that's probably what's happened here in this situation. She just let the ball drop, and you, in turn, are the one that was affected by it the most. That can be fixed. Yeah, afterwards, if you want to come back over to our booth, and I'll give you my card, or if you have my number, give me a call or email me, and I'll see what I can do to help you out.
Thank you.
Uh-huh. Any other questions? Okay. Okay.
My son has Simplex, and last year we shopped around just to we're self-employed and try to get better. We got turned down by every insurance company. We have Medical Mutual, and we just really have a catastrophic plan with a high deductible. But we got turned down. Do you have any suggestions?
Yes, I do. It is very difficult with predetermination. I do know that Aetna does have some plans that are out there that will avoid that, but do know as of September 23rd, your child's predetermination will not be a consideration under the new policies that were put in place by the government. So as of that time, your predetermination won't matter. So not that you want to wait till September 23rd, but there's no plan to hold a predetermination for a child after that date. So that might help you that way. But in the meantime, I do know that I had a child that had EB in California that I got insurance through Aetna from, and they were self-employed. So, but you have to look for the right policy. So I might be able to help you a little bit with that too as well. That's it. That's all I can do right now, guys.